Okay, parathyroid gland. So parathyroid we have four we have four glands on the corners. One on the top here, 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 and here on the top corner, on the four corners. And you cannot see it with ultrasound generally, but you can't try. But I never saw it. I saw it like one time or something, and I thought it is like a nodule. But this is how it is. What is mm, they are typically four glands located on the posterior surface of the thyroid from the back, and they are uh, two superior, two inferior, very small, like half centimeters, and the function secrete parathyroid hormone. So remember, we have the C cells in the thyroid gland was secreting calcitonin. C from thyroid, calcitonin. So calcitonin, its function to decrease the calcium, but the parathyroid is function to increase the calcium. Yes? Okay. So they act against each other to make balance for the calcium to be in the normal level. Normal level is something like 8.5 to 10.5. So it keeps the level within this level by if increase or decrease. So we have hyperthyroid, which is when you try to do the scanning, you have prime hyperthyroidism, which is going to be something in the structure of the thyroid itself, hyperplasia, carcinoma, or adenoma, or secondary that coming from other reasons like chronic renal failure, because chronic renal failure will cause decreased calcium. So it will need to increase parathyroid hormone to increase calcium. How to increase? You go in the bone, make resorption of the bone, take it from the bone, put it in the blood. That's how it works. And tertiary is after long standing from secondary hyperparathyroidism start having something called tertiary. So those we try to scan for or something before surgery or after surgery. Of course, we're gonna use the same thing. So by patient, you put the belly under his patient's shoulder, and you use the linear probe at like 7 to 10, and we're gonna go. I'm seeing you cannot see it, but still you can try to go longitudinal and transverse. Normal gland is not visible. If you see it, it means it is this pathology. So normally don't see it. Pathology, we have adenoma, which is most common cause of primary increase of parathyroid hormone, and it is gonna be like oval or bean shape, size 1 to 3 centimeter, little gonna be longer. You can see it, and it's gonna be has its own feeding artery. So we go for hyperplasia. The four glands will all of them will get secondary will be increased and secrete uh, parathyroid hormone. But they are smaller, less than 1 centimeter, smaller than the adenoma. They are multiple. And carcinoma, it is rare but aggressive. The same thing, we can say aggressive is going to be regular margin, it's going to be hypoechoic and increased vascularity. Ectopic adenomas, it can present in thymus gland or other parts of the body. We can use system, which is nuclear medicine, to locate it because you cannot see it with ultrasound, it's very hard, or use CT or MRI. Finite respiration, if you need some big one, you can just do the same thing you can do under ultrasound and just suck it. This is the picture. I saw it like one time, two times. I never imagined this is parathyroid adenoma. I thought it is like cyst or something, and it looks like it's just normal structure of the thing. This is how it looks, parathyroid adenoma. Questions? You want to do some questions? Okay, let's go. Mhm. Yes. Parasite adenoma. This is the most common one. Yes. Yes. So this is on. Let's do salivary glands. Salivary glands is very quick. You can see salivary gland will have three pairs. And three pairs of salivary. You have someone called the parotid, which is, it is be under the ear lobe. The big, the same like mastoid, the masseter muscle. If you press to like showing, and you press your jaw, you can see that you can feel it. And then submandibular, it's gonna be just under the angle of the mandible. If you press it, if you make massage for this, you can find you have more saliva, and have sublingual. If you open your mouth and raise your tongue up, you're gonna find something. Sometimes people see something like going like two streams coming out from the glands. So these are the three parts, the three pairs. The most important one is, of course, is the parotid one. Parotid is the biggest one, just next to the ear, and so it says the longer just under the tongue, and the mandibular just under the angle. Um, we're gonna do the same thing. We're gonna have linear probe, uh, supine little extended, the same when you do thyroid. Uh, we focus on parotid. We're gonna have work on the cheek, and the cheek, which is the region of the cheek, and have below the mandible for the submandibular, and the sublingual uh, under the floor of the mouth. I never did sublingual, but I did submandibular because, and then I said that it's not submandibular, it's just lymph node. What are the normal sonographic finding? Homogeneous, hyperechoic compared to us. I give like something very similar to gland, like very similar to the pancreas. If you see the pancreas, it is triangular shape, and the questions we're gonna see what we can see the Stinson duct, which is the main duct from the parotid. So these are questions. What is the main one of the parotid gland? I see Stinson duct. What is the main one of submandibular? Whartons. This one, what is some? It's gonna be in the pancreas. They ask about all those three ducts. They put the three of them or four and ask you which one of those is there. Sublingual is gonna be small hyperechoic located medial to the mandible. So this is triangular. You see lymph nodes. I never see the lymph nodes. I do it a lot. I don't see lymph nodes, but you can see lymph nodes. Triangle look like very similar like pancreas. Pathology of salivary glands. We have acute and chronic salidinitis. So salidinitis is mean inflammation called salidinitis. Um, Enlarged, hypoechoic, increased vascularity. Chronic, it's gonna be heterogeneous because it has fibers. It's gonna be hyperechoic. I have calcium. Tumors, benign tumor. Benign, we're gonna say it is hypoechoic or hypoechoic, but it is gonna be multiple shapes, but usually it doesn't have irregular border. Malignancy in anything irregular border, heterogeneous, and have lymph nodes. Cysts or abscess. I never saw cysts or abscess, but it is possibility if you have a stone into the salivary gland. Sjogren's syndrome. This autoimmune disease, people feel that you have dry eye, dry mouth. It has some antibodies. You can just detect it and say this one is autoimmune disease. So this is collection of what you can have together. We have the Sjogren syndrome, autoimmune disease. We have salidolysis, which is lysis is a stone in the duct. We have salidonitis, which is inflammation of salivary gland. We have adenoma, benign adenoma, and we have mucodermoid carcinoma, which is the most common malignant one, mucodermoid carcinoma. Salidinosis is benign painless enlargement of salivary gland. Ranula is mucus retention cyst in the floor. So these are, you just focus on salidonitis and which is the stone. This is the most important one, and salidonitis, which is inflammation. These are the two big ones that can come in the exam. So I have here Wharton's duct. Still, this come in the exam. Is Wharton's duct is the main of the submandibular, and Stenson is the one main of the parotid. We have salidonitis inflammation, and salidinosis is benign enlargement. Salidolysis is stone. Sjogren syndrome, autoimmune disease. Thyroglossal cyst, this one connection from the isthmus of thyroid to the under the neck or go under the tongue. Which is called thyroglossal duct or thyroglossal duct with cyst. Questions, couple of questions, so we can just don't forget it. Okay. Parotid gland. Yes, parotid gland. The largest one is parotid gland. Yes. Yes. Yes, sir. Intraparotid lymph node. I told you, they say it should, you can see it. I never saw it, but they say this is the most common mistake. They think it is pathology. You see something like dark, which is lymph node on the salivary gland, mainly the parotid gland. You saw it before? Yeah. You say this sometimes is misleading. Sometimes it is just lymph node. Mm, sublingual. Yes, as floor of the mouth is sublingual. Stones. What stones? Cellulitis, yet. Cellulitis is inflammation. Cellulitis is stone, right? Very good. Polymorphic, like multiple shapes. Yeah. Polymorphic mean multiple shapes. Well-defined hypoechoic homogeneous. Saliva. Salivary gland secretes saliva to make lubrication and digestion. Saliva is the don't do that. We look for the keyword. Keyword salivary, saliva. Look for the keyword. You're gonna find the answer in the question. You look for the keyword. Maybe you don't notice. No. Mumbus. I don't. I mean, we don't see it in United States, so a lot of people they don't see it. But overseas, you can go in the school, like elementary school. You go in the morning, you find someone come with huge cheek like this, and this what he has mumps, viral infection, same like come with all this child stuff like measles and all stuff. We have mumps, which is enlargement of post parotid due to viral infection. Yes, correct. This is what Tons is submandibular. Stinson, this one for parotid. I told you this one comes in exam, for example, 100%. They like these names, weird names. Oh, this is good for to put question, right? Yeah, this what how you feel. No, Sjogren syndrome. Sjogren. S is silent. Sjogren. Like George, Sjogren. Yes. Last one. Complex irregular border with internal debris. Abscess. Abscess, it has dirty wall, right? No, cavity. Look like cavity. But cavity is dirty wall and have debris inside, and it is hypoechoic, still like fluid, but it is this is abscess looks like. All the time have dirty wall because it has cavity. Uh, mm, yeah, amylase. Carbohydrates start digestion, like the bread start digestion in the mouth with saliva because it has amylase. Stinson. This one is submandibular. And then the Wirsong, this one is pancreatic, main pancreatic duct. So these three, they come in the exam. There is nothing called Sjogren syndrome. There's something duct. There's something called Sjogren syndrome. This one is not included. So just remember the three. They come in the exam. They put them together and tell you which one is pancreatic, which one is parotid. So Wirsong is pancreatic, Stinson is parotid, and Wharton is submandibular. branchial cleft cyst. Don't worry about it. This is something with come with embryology. I have this. So I want to do scrotum separate next time, so I don't confuse you, right? Let's do small parts. I can do, if you want, I can do some lymph nodes. So we don't have to go into lymph nodes next time, and that's it. So next time we can do scrotum like a big object, because this one's gonna be like a big one. So I'm gonna do this lymph node. So lymphatic system, number one is spleen. We're gonna leave spleen for now, and we're just gonna go into the lymph nodes. Okay. So lymphatic system. Section 2 is going to talk about the lymphatic system. So we have lymph nodes, small oval structure, filtering lymph fluid. We have lymph vessels with spleen, thymus, and tonsils. These are the lymphatic system. Normal lymph node ultrasound is going to be oval, like kidney shaped, same like the kidney, and it would have hilum and will have blood vessels, artery, and vein coming outside, and it has cortex, hypoechoic peripheral area, and have hilum, which is the hyperechoic center due to fatty tissue, and so this size has to be less than 5 millimeter to be normal, and it has to be kidney shape, and then in the neck or inguinal region you can find it can be more, up to 1 centimeter, and it has to be longer more than size. So the longer to the length to the width is gonna be like more than 2. You don't need preparation, you can just go with the linear probe, and if you go in the abdomen deep structure, you can look for the you can use the curvilinear, which is the abnormal one. Usually you have to go into the celiac trunk on the anterior aorta. You can go for the celiac trunk and superior mesenteric. You can see something lymph nodes here. So you have like cancer or something in the intestine. I want to look for lymph nodes. I go into just under the nutcracker syndrome. It's gonna be under the celiac trunk. Where the scan, mostly, of course, most of the time people come with find small nodules in the line of the sinomastoid muscle, and you get because have something from the scalp or the ear, and you come and check it. You can do you can see it axillary or the groin, or if you go for the abdomen, look mesenteric, which is going to be, as I said, on the under the celiac trunk. Lymphadenopathy mean I have enlarged lymph nodes, and it has to be more than 1 centimeter in short axis. Long axis is gonna be doubled. This one gonna be like 2 centimeters. It has hilum fatty, which is gonna be hyperechoic in the center here, and we have all those is gonna be the cortex. What are the causes of lymphadenopathy? Why someone has lymphadenopathy, which means I have a lot of lymph nodes. You can find some in the axillary, some in the neck, some in the axillary. Why they have multiple, and you have enlarged infection. We have bacterial viral tuberculosis can do this one, can have malignancy lymphomas, or something called sarcoidosis. Sarcoidosis usually comes to someone like 30 years old, and the lung look like tumors in the lung, and you go take biopsy, you find that it is a collection of chronic inflammatory cells. It is not, you call it sarcoidosis. Nobody know why. It could be autoimmune or something. They put them in on cortisones. So these are the reason for it have enlarged lymph nodes: sarcoidosis, lymphomas, and infections. Still, they are very important for if someone has malignancy, because when start having a spread of the malignancy, usually go through the lymph. Like some breast cancers, you go find you look for the lymph nodes in the axilla, which means that this gonna be till it started getting outside the breast, which is gonna be dangerous because it went outside of the chest. Rounded shape, increased cortical thickness more than 3 millimeter. Loss is the echogenic hilum, which is hyperechoic, and gabichaotic peripheral vasculature. It is not like being nice and like this one have one artery going out, one comes out. That can be something like very different. Reactive gonna be everything, but gonna be cortical thickening, and this happen with increased vascularity. It's usually happen with inflammation too. Inflammation, not infection, just inflammation. Clinical indication: if someone feels a lymph node, he can come and see, I want to check it, or have fever for unknown origin, or have cancer needed staging. You see, if it went to the groin, so it means it went out from the abdomen and it's going spread to the body. Suspected infection or inflammation, you can do the same thing. But usually, usually most of the time I see someone just do the neck because you have like any small wound in the scalp, he don't see it, and that's it. So this is the lymphatic where it is all over. Now, what is the note? Malignant from benign. You keep saying again, malignant is gonna be longer, more than longer, more the normal one longer than width. You're gonna find the normal. This is the normal one, longer than width. You go for malignant one, you're gonna find it starting being rounded, and this is the regular. This is the irregular one. You can see it is gonna be, it is width more than length, and it is irregular. Yeah, we can go in the neck. You can see in the neck, and usually anterior or in the posterior, gonna be on the line of the. You just say it is anterior triangle or posterior triangle of the neck. When they go just to scan it, you're gonna find it's very similar, like the kidney shape. It be something like this. I do it a lot because people get very worried when you see lymph node. You see maybe something wrong, and it's gonna just be lymph node, like just a kidney shape, and has something coming from the hilum. That's it. See kidney shape, hyperechoic fat, and this normal, and then just blood vessels. You're gonna find small blood vessel coming out. So larger lymph nodes greater than 1 centimeter indicate malignancy. Usually you do sandwich sign. You look in surrounding, compressing the aorta, around the aorta, just to go into to the celiac trunk. So normal is 1 centimeter. It has hilum. And this how it is. Look, it is just surrounding the aorta and IVC lymph nodes. Called sandwich sign. So what's normal? Normal tend to show central hilar vascularity, and malignant will be disfigurement, eccentric. Benign versus malignant. What is the causes for benign? Reactive, like have infection or inflammation, autoimmune disease. Size gonna be typically smaller than 1 centimeter. Texture soft, tenderness, it is gonna be tender, full of course painful, and shape preserved hilum. and the growth pattern is going to be tend to grow in size after resolving the ultrasound. Hypoechoic, preserved hilum, and you can see the blood vessel going through. Malignant, it's going to be irregular. Of course, you have to see that malignant is going to be irregular, large size, more than 1 to 1.5 centimeter. Texture is going to be hard and hyperechoic, non-tender. This is the difference. It is rounded, more than bean shape or kidney shape. It can be rounded. So this is what you have to say. You just need to know the difference between benign and malignant. Benign less than 1 centimeter, the other one more than 1 centimeter. This one firm, this one soft, right? This one tender, this one non-tender. This one oval, like kidney shape. This one is just rounded and irregular. Hilum is still there. You don't see the disfigurement. These are the biggest one. Diagnostic. We go with imaging, ultrasound, or CT. We can take biopsy if we need aspiration with under microscope. I will do blood tests. You can see if you have inflammatory cells like white blood cells high or lymphocytes for lymphoma. So, question. Yes, exactly. Abdominal lymph nodes. That's what you need. That's a question comes exam. You like these weird names, right? So you say, oh, this one could be a good question. So when you find something like this, so you have just to put it on your notes. Sandwich sign, ultrasound refers to the abdominal mass enveloped by lobe of bowel, and it is mesenteric lymphoma. Location in the mesentery, like around the celiac trunk or splenomesenteric. Hypoechoic mass, rounded, compressing like loop around the aorta, which is just more mesenteric, and you have to differentiate with TB and inflammation. Transabdominal, you go with the abdominal curved array, is curved one. If you look in the mesenteric region, you find central hypoechoic mass, and it is going to be sandwich sign. It means it is circling the aorta. Question for you. One centimeter, yes. 1 centimeter. 10 millimeter, 1 centimeter. A criteria: short axis, diameter less than 0.5, and length has to be more than to be abnormal. It has to be more than 1 centimeter. Abnormal finding, it is going to be yes, more than 1 centimeter is going to be abnormal. Rounded, it's going to be abnormal finding. It's going to be rounded instead of being kidney shape and long like this. It's going to be rounded and irregular shape. It is the mediastinum. You have the mediastinum. This is the medium sterni, and this is the sternum. And you can find the heart is here. You find it is upper superior part. You're gonna find the thymus gland is here. It used to be controlling all the lymph in the old days when it was in the infancy, in the womb. But after birth, it got lymph nodes. The bone marrow will take the control, and the thymus will only secrete T cells or T lymphocytes. Thymus gland, lymphatic organ, and it is located into the mediastinum. So this is abnormal measurement. You can see long and short axis. You can see it is just irregular, right? The abnormal one, and the normal one is regular and has hilum in the center. It is long. This one looks like very similar, like it is just rounded. A normal lymph node, you can see the blood vessel going out and back. You see the the hilum is there, still hyperechoic fat, and the cortex outside. You can see the blood vessel coming out. This is normal. If you go longitudinal, you can see it look like the kidney shape. So these are normal one. Abnormal one is gonna be rounded and gonna be irregular shape. Color Doppler, the normal one just to go from the hilum. Now you see it's coming from everywhere, right? This is the mean it is abnormal. Irregular one border is gonna be mean it is malignancy. So this one you can just focus and really say put it into different levels and tell you which one malignant, which one is benign. Question. Metastatic disease with the secondary lymph nodes. We have malignancy and have to go outside its place through the lymph nodes. Yes, exactly. So these are the very small things we did today. So we can just wrap it and close it, right? And